How to treat hypertension. The method is used for the treatment and prevention of the most common diseases, such as hypertension, angina pectoris, chronic bronchitis, bronchial asthma, allergic diseases, diseases of the gastrointestinal tract, and genitourinary system. The method proposed by Professor Pashchenko is based on the ability of carbon dioxide to control metabolism and energy. Shallow breathing is used to eliminate hemohypocarbia, normalize metabolism and mobilize the body's defense. It is aimed not only to normalize operation of functional systems, breathing, blood pressure, heart rate, pain relief. Its most important feature is the restoration of body tissues damaged by disease and their rejuvenation. Shallow breathing leads to increased carbon dioxide levels in the lungs. As a result of an increase in carbon dioxide content in the body at a physiological level, blood vessels dilate. Metabolism is normalized, and the delivery of oxygen to tissues by hemoglobin improves. How to normalize blood pressure using Professor Pashchenko's method. It is also important to understand that the elimination of deep breathing should be done gradually, and give your body time to readjust. Therefore, the elimination of deep breathing in the treatment of hypertension is carried out in stages. The task of the first stage is to ensure that breathing is not deep during the day. Deep and noisy breathing leads to vasospasm, with shallow breathing, invisible and inaudible. The partial pressure of carbon dioxide in the lungs increases and the blood vessels dilate. It is important to maintain shallow breathing while walking. To do this, you need to walk at such a pace that there is no deep, noisy breathing. If your breathing becomes deep or noisy while walking, you should stop and rest until your breathing normalizes. After breathing normalizes, you can continue walking. To do this, you need to walk at such a pace that there is no deep, noisy breathing. If your breathing becomes deep or noisy while walking, you should stop and rest until your breathing normalizes. After breathing normalizes, you can continue walking. You need to breathe only shallowly through your nose. Breathing during the day should be neither visible nor audible. If the patient has mastered shallow breathing and his general condition has improved, he can proceed to the second stage. The goal of the second stage is to reduce medication intake and improve blood pressure. The explanation of the second stage will be in the next broadcast. If you subscribe to my channel, you will be sent an additional message about the next broadcast. This is just the first step. The task of the first stage is to change the depth of breathing. Stop taking deep breaths and breathe everywhere only superficially, not deeply. In the next procedure, we will discuss therapeutic walking, which can be used to remove or reduce pain in the heart area without medications within a few days.